I can. They say you won't. I say I will. I am a fighter, and my fight is PCOD. A shout out to all of us for fighting a battle most don't even understand. Polycystic ovarian disease, also known as polycystic ovary syndrome, is a very common condition affecting 5 to 10% of women in the age group of 12 to 45 years. To answer all the massive list of questions relating to it, I am inviting, along with Dr. Mansi Chatrat, Dr. Aina Sood, gynecologist with a massive set of experience and expertise in the field. Thank you so much, Dr. Sood, for joining us.
Hello, I'm Dr. Aina Sood, and I'm really thankful to Dr. Mansi for giving me this opportunity to talk about PCOD and its related symptoms. I'm a gynecologist. I work in Patiala in Excel Healthcare Hospital opposite Punjabi University.
Welcome, Dr. Aina Sood. Thank you for being on our show today.
Dr. Sood, what is PCOD? What are the causes and symptoms of PCOD? What age can PCOD be detected?
So this is one of the most frequently asked questions, that what is PCOD? PCOD is polycystic ovarian disease. And what causes and what are the symptoms of PCOD? What causes PCOD is basically hormonal dysfunction or obesity or a bad lifestyle, which leads to obesity. This is what causes PCOD. What age can PCOD or PCOS can be defined? Now, PCOD is polycystic ovarian disease and PCOS is polycystic ovarian syndrome. So when a girl starts her cycles, initial few years we will expect that her cycles will be irregular, but if there are more than 3 irregular cycles in 1 year, we will start investigating why they are irregular. Irregular cycles mean that the cycle length is less than 2 days or more than 7 days, and the total cycle period is either less than 21 days or more than 35 days. So if your cycle range depends on these two things, then you do not need to be worried, even though they might be slightly irregular. But if you have 3 or more cycles in 1 year where your cycle length and cycle duration is different from this, then please, you need to get investigated no matter what your age is once you've started menstruating.
This is very helpful. How is PCOD diagnosed?
Question: how is PCOS diagnosed? So PCOS is diagnosed with the symptoms of irregular cycles, obesity, abnormal hair growth, acne. And the signs which we see is that the person is obese, she has hirsutism, which is increase in hair growth or abnormal hair growth, and her cycles are not regular. Plus, we get an ultrasound and hormonal profile for them. Since they start early, most of them start early, so early onset PCOD, as we cannot do a pelvic examination for these patients, we go ahead with a ultrasound and hormonal tests. We for in late onset PCOD, we also do the same things. We also check for the same symptoms, signs, as well as the investigations. But there we have the added advantage of a pelvic examination, which shows us that the ovaries are bulky and their volume is more than what it should be.
Also, is there a definite cure for it?
PCOD is basically not a disease, it's a lifestyle modification. So there is no definite cure for it as such until and unless you change your lifestyle, you get a healthy lifestyle, you get a healthy body, and you do not eat fast food or very fried or overtly spiced food. So it's basically a lifestyle change. Yes, you can maintain your weight at a particular what is good for your height, and you can defeat PCOD. It is not a very aggressive disease, but it is a very boring disease. So it takes time to come. You have to recognize it immediately, and it takes times to go. So don't be harassed that you've been on treatment for 2-3 years. It happens, but as soon as you achieve your goal weight, your cycles will become regular, and if you have any hormonal dysfunction, with hormonal medication you will always feel better very soon.
Dr. Soon, does PCOD affect fertility in women?
And is there a way to get pregnant quickly even if you're suffering from PCOD?
Now we come to another important question. This is a very good question, Dr. Mansi, because this is what happens to girls later on once they are married and they do not know that they have PCOS and they get married and then they come to know about this disease. Okay, how does it affect fertility? PCOS or PCOD, it will affect egg formation. Instead of the ovary making one good egg every cycle, it will make 8 to 10 eggs or even more than that, so that the volume of ovary increases, but there is no one good egg. So when there is no egg, the fertility issues will obviously there. Plus, once the patient gets pregnant, suppose there's ovulation after 6 months and suddenly the patient gets pregnant, that also happens. So what happens here is that the patient is more prone for abortions as well as IUGR later on in life, because the mother in these cases is usually obese, has hypertension or diabetes as an added dysfunction of PCOD. All right, I've been asked this many times that, ma'am, we have PCOD, but we have just only 2-3 months to get pregnant because the husband is usually working abroad or is in the army or is in the services and he's come for a particular time period. So, how do we get pregnant fast? Uh, I cannot say anything. You need to have ovulation induction. In these cases, you need to have close monitoring. You need to lose weight. Everything put together, it's a difficult thing. So it is always better that if you have signs and symptoms of PCOD, which are obesity, abnormal hair growth, or acne, or irregular cycles, please contact your doctor immediately so that whenever you plan to get pregnant, you don't take more than 2 to 3 months.
If you have PCOS, what are the medical problems that you are at risk for?
If you have PCOS, you have two kinds of medical problems. One is lifestyle and the other one is organic. So lifestyle changes will be that you might be obese, you might not be able to enjoy exercising as other people do, you might not be able to go out and have more fun. Acne is another problem. Hirsutism or abnormal hair growth is another problem. You might be on treatment for all these diseases. Organic diseases include obesity as one, and then those who have predisposition for these diseases like hypertension and diabetes will get them at an earlier age. So that is even more scary, that you have these diseases which usually occur in the age of above 50. You might have it at 30s and 40, in your 30s and 40s, which is your prime time basically. And later on also, worst scenario is that you have a syndrome called syndrome X, which is extreme obesity, hypertension, diabetes, to the extent that the patient is not able to move herself and needs surgery for weight loss at that time. And plus, you might have hormonal dysfunction, which might cause PCOD, or the PCOD has caused this hormonal dysfunction. So all this is very distressing, it is very boring, and it needs to be stopped earlier on in life rather than coming at a full-blown PCOD stage.
What can I do on my own to lessen the symptoms of PCOD? Does losing weight help in PCOD?
Now comes the most important thing. That is a healthy diet. You can change your lifestyle. You can go for exercise regularly. You can get a diet chart made by a dietitian, which will tell you the amount of calories for your height which you need and the amount you need to lose weight, and plus not have any nutritional deficiencies at a growing up age. So the earliest you reach a nutritionist, you reach your gynecologist, you get yourself investigated, that is the best way to lessen your own PCOS symptoms. Of course, losing weight will help you a lot. How does losing weight help you a lot? Because it's a cycle. The hormonal dysfunction or PCOD will help you will make you regain weight, and the gained weight will cause more PCOS. So what you can stop by yourself, for the medication the doctors are there, for the diet the dietitian is there, and your own preferences are there. But once you reduce your obesity, once you're exercising, once you're having a proper diet, what happens is that the peripheral fat reduces. This peripheral fat, which we put on because of fast food, because of bad food habits, because of going out more often, or a bad lifestyle, not exercising at all, changes the female hormone environment into a male hormone environment, which causes PCOD as such. So once we reduce our peripheral fat, abdominal fat more likely, once we reduce that, the PCOD symptoms will reduce and you will be able to regain your normal self and not revert back to PCOD once you stop the medications.
All about. So, the biggest takeaway has been that PCOD is not a disease and we can handle it at home easily. All we have to do is to manage our lifestyle and we have to control our weight. So, I am here today to help you with both. Let me explain a day's diet plan which not only would help you lose weight but could also help you manage your insulin levels and your hormones and hence help you with PCOD. Over the years, many researchers have shown that in case we try to go off wheat and off dairy for some time in PCOD, it can help us in lot many ways. So today's diet plan, I would try to limit wheat and I would try to limit dairy to some extent. Let's start our day with bay leaf water. Bay leaf is our tej pata. So all you have to do is to take couple of leaves, soak them overnight. In the morning, you can just boil it and bring it to approximately half and have that water as bay leaf tea, lukewarm, first thing in the morning on empty stomach. Bay leaf has numerous health benefits, but it is also good for controlling our insulin levels and can be helpful in our hormonal disorder as well. Plus, it will help in bloating and that uncomfortable feeling in the stomach. So, start your day with bay leaf water, followed by some dry fruits, maybe 5 almonds, couple of raisins, couple of walnuts, depending on your choice, and then we can move on to breakfast. Now, for us to lose weight, our diet should be full of fiber, carbohydrates, good carbohydrates, and proteins. It's only a balanced diet that helps us to lose weight. A word of caution, please do not reduce your food, do not eat less, do not try to skip meals. Eating less, starving yourself, not nourishing yourself properly will lead to several more health problems, and we would not lose weight also. So, losing weight is a process, and in this process, we will eat good food and we should be on full stomach. So, we are trying to avoid wheat in this diet plan. So, let's try to make a multi-grain atta. Let's add barley, let's add a little bit of oats, little bit of jawar, little bit of chana atta and little bit of soya atta. So let's make a multi-grain atta out of all these attas. You can take them in equal proportions or you can take soya atta slightly less as compared to other attas. Secondly, we would try to skip milk. So in this particular diet plan for breakfast, let's say we can have a besan chila, we can have a moong dal chila, we can have oats chila, but always remember we must have lots of fiber. So that means lots of green vegetables, lots of vegetables. So what we can do is one portion of, let's say, besan and one portion of vegetables. It could be spinach, it could be beetroot, onion, capsicum. So 1 to 1 portion of vegetables, plus you can have besan, you can have oats atta, you can have jaw ka atta, and you can have moong dal, so or any other dal, arhar dal, chana dal, and we can make a chila out of it. You can have it with pudina dhania chutney, or you can have veg oats, you can have upma, you can have poha, or you can have this multigrain atta that we were talking about. You can have a stuffed roti with little curd. Though we are trying to avoid dairy, but if you wish to have little curd, go ahead, we can do that. For your mid-morning meal, I think a green juice is the call of the day. Since we need a lot of fiber, a lot of B12, a lot of vitamins and minerals for PCOD, a green juice goes a very long way in fulfilling all this. So maybe a juice made out of bottle gourd, that is ghee, beetroot, chucundar, mint leaves, pudina, coriander leaves, dhania, maybe some celery if you can get hold of, little bit of ginger, a little jeera, and make a good green juice for yourself and have it every day around mid-morning. This will really help you bring up your deficiency levels and add lot of fiber, and your gut will feel happy. For lunch, we must have one portion of green vegetable, one portion of proteins, and then you can have a multigrain chapati. And along with that multigrain chapati, you can have one big bowl of protein, which could be kabuli chana salad, it could be green moong dal sprouts salad, or you can have some kala chana, some paneer, some tofu, or some moong dhuli dal, or some moong dhuli dal salad if you want, if you don't like eating dals. But some portion, big portion of protein, big bowl of green vegetable, one full plate of salad, and then whatever chapatis you are hungry for. Try to keep it to 1 to 2, but have your multi-grain chapati. Around mid-evening, that is the time when you can have a glass of lemon water, you can have a glass of buttermilk. Use very little curd and you can add water, or you can procure buttermilk from outside, plain basic buttermilk, and you can add some bhunawa jeera. Jeera is your cumin seeds. So you can just roast them and add that to your buttermilk, and you must add some curry leaves. Curry leaves also have very good effect on insulin and also helps us control our hormones. So this time again, if you are a little hungry and you wish to munch something, then a trail of seeds is a good idea. Pumpkin seeds, sunflower seeds, flax seeds. So you can add all this together and make a trail out of it and have them. I would be doing a separate video on flax seeds and their importance on our health, but flax seeds go a long way in settling in helping us in our PCOD. So maybe you can add that in your everyday routine. For dinner, try to skip chapati for maybe 2 to 3 days in a week or something like that, and have a big bowl of dal or sabzi or salad, or you can make a protein salad, add some green moong dal sprouts, chana sprouts. People who find that heavy at night, they can have moong dhuli dal soup, any other clear vegetable soup. You can add some chicken soup. You can have some chicken and salad and green vegetable for dinner. If you want, you can also have chicken for lunch. But if you are skipping roti at night, then maybe for non-vegetarians, chicken can be a good idea. But try to procure organic, because of all these hormones that are given to the chickens, that sometimes harms us than does us good. Finally, how do we call it a day? At night, before you retire, please have some cinnamon water. So you take very small piece of cinnamon, boil it in water. It has very sweet taste to it, so it's good and nice to have. Warm it up and have it before you retire to bed. Here, I must insist on one thing. Please try to have early dinners. Try to finish your dinner around 7ish. It will help you immensely in losing weight, and the next morning you will feel so light, so good. Of course, if you feel hungry later, you can have as many fruits as you want. You can munch on some dry fruits, some seeds, and have your cinnamon water. Cinnamon water will help you take away a lot of cravings, and it will make you feel fuller. Thank you, Dr. Aina Sood, for explaining so simply and so easily what PCOD is all about.
Finally, I would like to thank Dr. Mansi for this wonderful session. It was important that our young generation comes to know about these things and comes to know of the problems they face because of unhealthy lifestyle, fast food, not sleeping well, and stressing out a lot on their work or academic performance or whatever. And the young ones, especially in the reproductive age, not able to conceiving, and the elder ones having all these problems of abnormal hair growth and weight gain, should always consult.
Thank you, Dr. Sood and Dr. Mansi. This session has indeed been very insightful. Please feel free to ask any questions that you may have. Don't forget to like, subscribe, and hit the bell icon. This is your host, Trisha Sehgal, signing off.